Good evening. I'd like to call to order the City Council meeting of Monday, April 20th, 2020. Please rise and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
Here.
Here. Yep. Yes. I would like just to advise everyone, if you're not speaking, could you please mute your microphone? Thank you.
Okay, Lalum?
Here.
Manti? Here. Adamski?
Here.
Toby?
Here.
Billhauer?
Here.
Why?
Present.
Thank you.
All right, thank you, everyone. First item on the agenda is approval of the consent agenda.
So moved.
I have a motion by Holeen and a second by Hoyer. Any discussion?
You've been muted. To unmute yourself, press *6.
Is there any discussion? All those in favor signify by saying,
Did we lose the council meeting?
you gotta do the roll
You are
call
no
vote.
longer muted.
Sorry. We're here. Can you hear me?
Okay.
Can now.
All right. Yes.
Okay, we need a roll call vote to approve the agenda. Kristen?
Oh, the muting rules. Okay. Here we go. Albertson.
There. Yes.
Bueller.
Here.
It's yes or no?
Here. Same thing I did. Fire.
Aye.
Colleen.
Aye.
Lalum.
Yes.
Manti. Yes. Adamski.
Yes.
Roby.
Aye.
Billhauer.
Aye.
Why?
Aye.
Motion carries.
All right, thank you. Item 5 is the public comment period, and this is the time reserved for anyone who would like to make a public comment to step forward and do so. Please state your name into the microphone and just say your last name, permission to speak, and I'll call on you. If it's related to an agenda item, please wait until that agenda item is taken up by the council and there'll be a better time for it. Is there anyone who would care to speak? Councilman Billhauer?
Pete, do you know, because I talked to several people today and gave them the number and their interest in calling in. Do we know?
There's a bunch of them that have called
Is
in.
there? Okay, got it. Thank you.
Would anyone care to speak? Okay, hearing none, we will move on. Item 6 is approval of the agenda.
So moved.
Motion by Billhauer and a second by Holeen. Any discussion? Oh, actually, I was going to say to move item C down after E. So with that adjustment, I had a motion by Billhauer.
That's fine with me.
Fine with you, Holeen? Okay. Amended motion. Any discussion? Kristen, will you take a roll call vote, please?
Okay. Albertson.
Aye.
Bueller.
Aye.
Hoyer,
Aye.
Pauline,
Aye.
Lallam,
Aye.
Manti,
Aye.
Rudensky,
Aye.
Roby,
Aye.
Billhauer,
Aye.
Why?
Aye.
Motion carries.
Thank you. Item 7 is the regular agenda. Item A is Tract 1 of Carter Trail Edition, Annexation and Zoning. And item 1 is Annexation Resolution Number 20-20. Is there a motion? Have a motion by Helene and a second by Rudensky. And there is, I'm going to ask the Public Works Director, City Engineer to give an introduction to this, but this does not have a public hearing, but if anybody wants to speak regarding the annexation, you just have to let me know. Otherwise, we will have a public hearing for the zoning portion of this. So Heath Von Eye, will you please tell us about this one?
Yes, thank you, Mayor. Am I coming through okay?
Yes, just fine.
Great. So we have before you tonight's resolution for the annexation of the Carter Trail portion of land out near Lake Kempesca. This is in relation to the recreational trail that we're trying to accomplish a full loop eventually around the whole lake. And this is kind of the southeasterly portion of that loop. This property has been donated to the city by the Carters and is currently outside city limits, and so needs to be annexed and then subsequently zoned for our use of it as a recreational trail. So we'd be glad to help answer any questions. Urban planner Brandy Hanton is online with us as well, and we'd be glad to help answer any questions you might have.
All right, thank you. Are there some questions? Councilman Vilhauer?
Heath, for those that may be just tuning in for the first time in this, can we pull up a map of what we're talking about here?
Absolutely. And I will scroll to that on my screen, and I'll share my screen with you here. Is that coming through?
Yeah, it is, Heath.
Yep, it's good.
So you'll see we're out here on near the intersection of several roads. Actually, you're off the end of Hidden Valley Drive. Just for context of where we're at the south end of Pompesca Drive, and that's also where South Lake Drive curves around and continues southerly along the west side of this Carter property. This parcel here is the Carter property, and this component that is hatched is what's being proposed to be annexed and zoned as a dedication from them to the city.
All right, thank you. Are there any questions about the annexation? All right, then we'll take action. Kristen, will you do a roll call, please? Vote, please. All in favor signify by saying aye.
Halverson,
Aye.
Bueller,
Aye.
Hoyer,
Aye.
Pauline,
Aye.
Lallam,
Aye.
Manti,
Aye. Slow on my fingers there.
Rudensky,
Aye.
Roby,
Aye.
Billhauer,
Aye.
Why?
Aye.
Thank you. Motion carries.
All right, thank you. And item 2 is the second reading of ordinance number 20-13, approving and establishing the zoning designation of R1 Single Family Residential District for Tract 1 of Carter Trail Edition.
So moved.
A motion by Vilhauer and a second by Holine. And Heath, you want to add anything to what you already said for the zoning?
I'll just specify that the proposed zoning for this area that we're annexing is R1, Single Family Residential District, which is, of course, very accommodating to the area. That's what we have to the immediate west. and the rest of the area to the east, of course, remains in the county. So this was also proposed to the Planning Commission. I forgot to note that in the last case, but both were recommended unanimously for approval to the City Council.
Okay, very good. Thank you. I will go ahead and open the public hearing now. And if anyone would like to speak on this item, please just state your name and say permission to speak. Not hearing anyone, so I will close the public hearing and look for council questions or comments. Councilman Billhauer.
Heath, or whoever might be able to best answer this, I think I posed a question via email last week. Has this gone out for bids? Because that is planned to be done this summer, correct?
Yes, the Councilman Vilhauer, the tentative plan was that this portion of the pathway be bid this summer. The design is complete, and we've recently wrapped up some loose ends on some easements and things of that nature. However, I can tell you too that this is one of the projects that's in the hopper pending bids that the mayor and myself, the finance officer, would like to communicate to the council on, how we're going to prioritize the continuation of some of these projects and which bids we do want to continue with and don't want to continue with. But as of now, yes, this is earmarked to be bid and constructed yet in 2020.
Okay, thanks, Heath.
This is a good question. We will have some tough choices to make because we think our revenue is going to fall short of our budgeted revenue, and so some of the projects will probably have to be cut. So we'll be going through that with you shortly. Are there any other questions or comments? All right, seeing none. Kristen, will you do a roll call vote, please?
Okay. Albertson. Albertson.
Aye.
Bueller.
Aye.
Hoyer.
Aye.
Pauline.
Aye.
Ballum.
Aye.
Manti.
Aye.
Rudensky.
Aye.
Roby.
Aye.
Vilhauer.
Aye.
Blythe.
Aye.
Motion carries.
Thank you. Item B is the second reading of ordinance number 20-12, amending the zoning map of the city of Watertown, South Dakota for a portion of River Ridge Estates from A1 Agricultural District to R1 Single Family Residential District. Have a motion by Holeen and a second by Rudensky. And I will ask Heath Von Eye to explain this one too.
Okay, thank you, Mayor. This action tonight is related specifically to a rezone. This is areas of land that is already annexed to the city, and the applicant is simply applying to rezone these areas and subsequently plat some lots and develop for residential development. This is up in the River Ridge subdivision. And in a discussion last meeting, the first reading of this rezone, we talked about the parkland dedication. Our urban planner, Brandy Hanton, was able to confirm that the parkland dedication acres that are provided are met without needing the detention pond area. I know that was one of the questions that came up, was whether the detention pond area was required as part of the park area. And they are able to meet the parkland dedication minimum requirements without the detention area. So I wanted to point that out this evening under the second reading. And there was also some discussion about the continuation of Cheyenne Lane that I'll pull up and share my screen here once again. Maximize that. So this is the portion, the hash portion is what's being rezoned to R1 from A1. And there's a series of lots that will include upon subsequent platting. This portion right here, Cheyenne Lane, we talked about the last reading on the potential extension of that as it's adjacent to the designated park area. And in discussions with the developer, it's been made known to them that we would have interest in seeing this built. We staff recommend that we address that during the platting process and the subsequent development agreement that would have to accommodate that plat. I can tell you already there's been discussion on, whether it's appropriate to extend this ahead of any park improvements being made, whether there should be something in the development agreement that allows for the extension of Cheyenne Lane when or upon the improvement of the park area, and things of that nature that I think are good talking points that we need to work through with the developer and would be ironed out and subsequently approved by the council at the time of the development agreement. And so I think that we've got time and methods in our procedures to account for that extension of that roadway in the future here. Aside from that, I think that helps address some of the questions that came up from the first reading, and we'd be glad to help answer any from tonight.
All right, thank you. Oh, Councilman Roby, please, go ahead.
Heath, if you extend Cheyenne Lane, that goes into the green. Does that cut away some of the park land? And how does that affect the minimum requirements?
Okay, so good question. The green is actually just ag zoned land, not to be confused with parkland, but the actual parkland will be in this red hatched boundary here. So what would happen is if the council required that extension or included in the subsequent plat, they would have to plat this right away, extend this roadway. That can all happen with this being zoned ag and really doesn't affect anything at all because we can allow for a street and a right of way in an ag zone land adjacent to that residential.
Thank you.
You're welcome.
Very good. Any other questions?
Question by Bueller.
Go ahead, Councilman Bueller.
Heath, I just want to make sure I understand this. If they extend that road into that ag portion, how far would that go? Would it go all the way to the end of where that first line is on the park?
Yes, for the portion immediately adjacent to the parkland. I don't know if you guys can see my pointer or not, but it would run this extent right here.
Okay, and then it would go to the southeast. So it'd be just a straight on extension from Cheyenne Lane?
Correct.
Okay, and then who would be responsible for building that? The city would have to put that extension in?
No, actually that would be the developer's responsibility as part of the subdivision improvements for their development.
Okay, so they'd want to write a waiver to protest probably.
Well, that's where those future discussions of the developer, which is already initiated with staff on, what makes sense on when to extend this. Does it make sense to do it now when there's no park improvements out there? And then the city's, however many feet this is of street that's paved and needs to be maintained, even though there's no park improvements for people to drive up here and access. So what he would potentially propose down the road when we get into the development agreement is to postpone the extension of this and coordinate it with the timing that the city decides through the park board and the park department on when to make the park improvement. And then at that point, that's what I would propose as staff is to make sure that at a minimum, the developer's responsible to build it at that point. And between now and then, I think that's what's up for discussion. Do we just postpone it till that point and have that hard timeline in the development agreement and or explore other options? But essentially, whenever this is required of them, it would be the developer's responsibility to build it and fund that completely.
Heath, how would they make the turnaround?
Okay, so that's another good question, Councilman Bueller. What we would want to require at a minimum for emergency response vehicles, and just because in a lot of cases our garbage trucks and things of that nature, we have some dead end streets out there. What we should be requiring here for it is at least put a temporary turnaround in for emergency response vehicles, garbage trucks, things of that nature, and the general public that drives down a dead end street doesn't have anywhere to turn around. So in the construction plan review phase, we as staff would want to ensure they have the appropriate temporary turnaround at the end of this dead-end street.
Thanks, Heath.
You're welcome.
Thank you. Are there other questions? Councilman Albertson? You're just getting ready to
Nope.
vote? Okay. Okay, I guess I forgot to open the public hearing, so I will do that right now. If anyone would like to speak on this, I have opened the public hearing, and now's your chance. Just say into the microphone your last name and permission to speak. Hearing none, I will close the public hearing. And look for council action. Kristen, will you do a roll call vote, please? All those in favor signify by saying aye.
Albertson,
Aye.
Bueller,
Aye.
Hoyer,
Aye.
Pauline,
Aye.
Lallam,
Aye.
Manti, did you hear? Nope, Manti,
Aye.
okay, Rademski,
Aye.
Roby,
Aye.
Billhauer,
Aye.
Y,
Aye.
motion carries.
Thank you. And we've moved item C, so we're on item D, which is approval of resolution number 20-21 for repeal or carryover of capital outlay appropriations from the 2019 fiscal year.
Second.
Motion by Holeen and a second by Hoyer. And I will ask Kristen to please tell us about this one.
Okay, thank you, Mayor. This is the process that we do each year. Based off of our home rule charter, we're allowed to carry over certain capital expenditures that haven't either been completely billed out or started for a 3-year time frame. So I've listed each of them by their fund. I can go into specifics. I will say that some of them have already either been purchased and delivered, and it was more of a timing, and that's why we're carrying it over, or the project has been bid. In the general fund, the ambulance equipment and the snow removal equipment has all been purchased and delivered. The Park and Rec, the 2 roof repairs were part of our old insurance claim, and the repairs were pushed back just, I think, due to some timing and weather, but those are slated to happen this year. In regards to the capital improvement fund, I think there's only a couple in here that have actually already been bid. I know the big one is Jackson City Park. That one was actually bid last year and held off due to the flooding. So that one will be carried over, but that one I think is already under contract. If we move on to E911, those radio base stations have already been purchased. And for the sewer and solid waste fund, everything besides the server installs have started. And the airport has also been bid. So if there's any specific questions, I can try to answer them. During the conversations with the departments, if the purchase had not been made or the contract had not started, and they were waiting to do it in 2020, we did ask that they have a further conversation with the mayor and myself just to kind of see where we're at with the 2020 budget. So, thank you.
Thank you, Kristen. Any questions or comments, Council? Councilman Billhauer?
Kristen, the apron reconstruction at the airport, is that over and above the work that's going to be done as part of the terminal construction project?
Yes, this isn't part of that. This was actually a project that was, I think it's already, I know the design is done,
Okay,
but
okay.
it's before the terminal.
Okay, and that's one of the, AIP projects that we pay 6.5% of, is that right?
That's correct.
Okay, thank you.
If that was a carryover, wouldn't that have been the 5%?
No, we have, because we pay everything up front.
But our cost
So
shares.
we have to have the budget for the total amount. and we're reimbursed.
Right, but the reimbursement
But
amount, are we cost sharing at 5% or at 6.5%?
This one I think made it in before the 6.5.
Okay,
Yeah,
good.
I think it
I'd have to check, but I think it might have.
Okay, good, thanks.
I think so. Yeah, good deal. Thank you. Other questions or comments? All right, roll call vote, please. Signify by saying aye if you approve.
Okay, Albertson,
Aye.
Bueller,
Aye.
Hoyer,
Aye.
Pauline,
Aye.
Lallam,
Aye.
Manti,
Aye.
Rodemsky,
Aye.
Roby,
Aye.
Vilhauer,
Aye.
Y,
Aye.
carried.
Thank you. Item E is approval of resolution number 20-22, transferring the city's urban renewal loan program funds to the Watertown Development Company for the continuation of the urban renewal loan program.
So moved.
Have a motion by Hoyer, second by Holeen, and I'll ask Kristen to explain this one, please.
Thank you, Mayor. I can actually pass this off to Matt. Matt actually did the work to
Okay.
draft the resolution. So I think I'll hand it over to Matt, and then if anybody needs me, I can answer any questions too.
Thank you.
Thanks a lot, Kristen.
No problem.
What you have in front of you here is a resolution, like the title says, to transfer the urban renewal revolving loan funds to the WDC for administration and continuance of that program. We were approached by Chris from the WDC a while back. He had been approached by various folks in the downtown area with their work in the district and asking about the status of the loan program. And at the end of the day, you know, the WDC has the capacity. They have this initiative that's focused on the downtown area, and so we thought it seemed to make sense with the council's blessing that the WDC be given these funds to continue administering those loans. I think the intention, my understanding, I'm assuming Chris might be on this call, so I would ask him to chime in, but I think the intention originally is to continue the program as is, but I will note that there is language in there that basically, you know, once this money's gone, it's being put under the purview of the WDC Board of Directors. So if 5 years from now they decide that there might be a better use for those funds, then they may so deem that. So if you have any questions, let me know, please. Hey, Matt, Chris here. Can you guys hear me?
Yes.
Yep. All right. Excellent overview, and that's correct. Our plan is to keep it as is for now, and there are no new plans to do anything different with the money except to allow the businesses to apply and use it for their storefronts. So I'll answer any other questions.
Thank you, Chris. Council, any questions? Councilman Vilhauer?
Matt or Chris and whomever, the amount that we're looking at transferring over, is that both the revolving loan balance themselves as well as the cash that's restricted for that? I guess I just want some clarification if that's the amount they're looking at moving over.
Well, I guess I'll chime in and maybe ask Kristen to chime in as well. I should have mentioned that in my overview. The current balance is $133,000. There's also $6,305 roughly outstanding.
Okay.
And Kristen and I were discussing that, whether or not we would just transfer the balance of that once those accounts receivable are paid by the end of the year. And I think that Kristen would prefer, just to clear out those dollars. But I believe, and Kristen can correct me if I'm wrong, I believe there's also some restricted funds like $14,000 or some other amount that also is designated for urban renewal funds that would not be affected by this. Kristen?
Yeah, so the $133,192.34 is the restricted cash that's been set aside for the revolving urban renewal loans. There's a $6,300 balance, as Matt stated. The Urban Renewal Fund has about $14,000 in other cash. We would maintain that. That's part of that assessment revenue that has come in over the past years. So this really has nothing to do with that. Okay. This is only the loan portion of the cash.
Okay.
And my plan is once we receive the last loans paid off, then I would also transfer that money to WDC.
Okay. So it would be the restricted cash as well as the loan balance that we're looking at moving over. Okay.
Yep.
Now, what about, because at the last council meeting 2 weeks ago, we had talked about going to interest only on those loans for the time being. So who was going to administer that after this juncture? I mean, is the development company going to step in now or will that still be our responsibility to pursue collection of the interest and eventually the loan balance?
The plan is to keep those loans just still with the city. We've got them set up.
Okay,
They're all probably just going to continue the way they are, but anything new will go through WDC.
Okay, thank you.
All right, thank you. Councilman Holeen?
Thank you, Mayor. Question for Matt. Just looking at my definitions here, the urban renewal used in the resolution, I'm wondering, will that coincide well with state law? I'm looking at the definition of urban renewal in South Dakota Codified Law 11-8-4 or 11-8, where specifically it says urban renewal is used to renovate a slum or a blighted area. And that's specific in state law, and I don't think that we'd be in any trouble doing our own definition with this, but I'm just curious to make sure that we don't create an urban renewal for Watertown and then it doesn't satisfy the definition of state law.
So thanks, Councilman Holeen. So the little history, the Urban Renewal Fund the Urban Renewal District was set up under state law that you're referencing there. And so we've been operating under that framework for however long the Urban Renewal District has been around. I believe it was the 80s. The funds that we're actually transferring right now were community development block grant from the federal government via the state many years ago as well. And so that's the source of those funds. I guess to answer your question, once we're transferring these funds out, they're no longer under the purview of that framework you're referencing in state law. They're just being administered privately. But for now, at least, it's going to be administered identically to what we had been doing. Was that more confusing, or hopefully I shed some light on your question?
No, I think that would have been my understanding as well. And like I said, I don't think we're going to get in any trouble. I just wanted to make sure that there wasn't a technicality that would create any problem for us.
No, I did the research a while back about if there's any sort of restrictions on that money. I mean, it's been so long. I could not find anywhere that indicated there would be a restriction for us to transfer that money to the WDC for the same purposes.
Thank you. Any other questions?
Mayor, this is Adam.
Councilman Lallam, go ahead.
What kind of oversight will we have over that if we transfer that over to the Watertown Development Company?
Well, that'd be at the council's discretion, of course. The proposal you have in front of you would remove the council from oversight, period, and put it under the oversight of the Watertown Development Company Board.
That's fine, but what's the dollar amount that we're transferring?
It'll end up being right around $140,000 once the remaining accounts receivable come in.
Okay. I'm just wondering, and it's not that I don't trust the Watertown Development Company, but if we're transferring $140,000, it'd be nice to know, what it's used for. I mean, they're talking. You said that's something about a 5-year. Is how long they would do something with that?
That was hypothetical. I mean, the idea is that, and Chris, I'd invite Chris to jump in, but I think the plan in the short term is to continue administering those loans, but there might come a time where if there's no interest in those loans anymore from people, they could decide that the money could be better spent helping the downtown district in some other way.
Yeah, Chris here. I mean, I could do some reports too to the council if you'd like on applicants and different things. You know, really the only thing that we talked about, and I know slightly has been used in the past, is some people have their storefront fixed up, but then they ask can it be used for the inside to redo some things. So I think just the need of that program, I don't see it being just going away and swept into our checking account for us to spend. This will have its own account. And it'll be ran just like it is now, except we'll be able to market it and administer it and take that burden off, you know, off the city.
Yeah, and like I said, it's not that I don't trust you. I just,
Right.
$140,000 that currently the city controls, and we can transfer that to an outside entity, whether it be you or someone else. I'd like to know what happens of it.
Yep, and I could report as you wish. That's not a problem.
That's all I got.
Thank you.
Mayor Albertson.
Councilman Albertson, go ahead.
Now, Chris, the intent is still to use all of that money that is there for downtown or the uptown area? Yeah,
Yep.
Thank you.
Correct.
Anyone else?
I'll add one thing too, just to clarify on Dan's point too, is there is a subcommittee set up of downtown business owners that would review applications, and then those would be forwarded on to our full board for review. Much like we do with the Workforce Development Council now, where we have the Attract and Enhance program, that's a subcommittee of different HR personnel throughout the city, and then they make recommendations for that program. So we do get outside involvement outside of our board to overview those applications as well.
Thanks, Chris.
Bet.
All right, thank you. Anyone else? All right, we'll have a roll call vote. All those in favor signify by saying aye.
Albertson,
Aye.
Bueller,
Aye.
Hoyer,
Aye.
Pauline,
Aye.
Lallam,
Aye.
Manti,
Aye.
Rademski,
Aye.
Roby,
Aye.
Billhauer,
Aye.
Wise.
Aye.
Motion carries.
All right, thank you.
Thank you.
Thanks, Chris. We're going to move on to item C, which is review of the continued necessity of ordinance number 20-14, an emergency ordinance relating to the pandemic outbreak of the novel coronavirus COVID-19, providing for the closure of certain businesses to on-site, on-sale patrons. And this is, of course, our emergency ordinance that closed down the list of businesses, and they were generally recreation and entertainment type of places that existed for the purpose of bringing groups together. And there have been a lot of comment on that in both directions, from businesses that were closed, just challenging it, and also from folks who were glad that the council did that and wanting actually us to take further action. So we're revisiting that just to see if that's still what the council wants to do. And before I open the public hearing, I'll just ask the city attorney, Matt Roby, if you want to add anything to that.
Thanks, Mayor. That was a pretty good overview. As you'll recall, there is a provision in this ordinance that the council approved the last meeting that requires a review at every interim meeting here. And Glenn had asked me earlier a question about what would happen if this were repealed outright in relation to the governor's executive order 2020-12. The answer to that is the governor's executive order applies across the state as is today. And so if this ordinance went away in its entirety, we would fall back and still be governed by the citizens should still abide by the governor's executive order. There's quite a bit of room in there for businesses to operate and make certain adjustments and that sort of thing. One other thing I will add before I be quiet is there has been some discussion about what that would look like from an enforcement standpoint on the local level. And if the council were to take the approach of adopting an ordinance that would basically put into effect the governor's executive order, you could, on the local level, add some nuisance-like language that would give us the ability to enforce that on the local level. So, if, for example, an establishment were violating some sort of social distancing or number of patrons in an area directive, that the police department could abate the nuisance, essentially, where they could go in and require folks to disperse. So just some food for thought there, and stand by for questions.
Thank you. Councilman Vilhauer?
Matt, I've got a question. Okay, you explained what would happen if we were to repeal that. Now, we could do that tonight, correct? At this meeting?
Correct.
Okay. Let's say that let's say we want to repeal, but we also want to put something else in place. Okay, if we repeal it, the governor's proclamation automatically kicks in. Let's say we want to repeal it, but also want to do something else. What can we do tonight from a administrative or from a mechanical not mechanical, but logistically, how long or what can we do tonight, or how long would it take for something new to kick in if we wanted to propose something new tonight? I mean, do we have to go through a first reading, a waiting period, a second reading, public hearing, the whole 9 yards?
Yeah, again, this kind of goes back to what we did at the beginning here. We have language in our charter that allows implementation and adoption and effectiveness essentially simultaneously for emergencies. But state law also calls for a second reading, 5 days between the first and the second reading, and then it can be effective. So I guess my recommendation would be that that the council, if they were to choose to put a new ordinance in effect, that they would set a meeting, another meeting in the next day or two, and we could have that on the agenda.
So from a practical standpoint, we'd be looking at what, at least a week before something could become effective then? Is that a fair statement? Ballpark?
Yes.
Okay. Okay, thank you, Matt.
Yes.
Mayor?
I haven't gotten a motion yet, and I'm feeling a little bit uncomfortable
No,
with
that's
all
okay.
the
You go ahead, I'll ask.
discussion. And I was just getting ready to look at that. So a motion to approve would be essentially approving what we already have and just basically reiterating that's what we think is right. And so I think we can have more discussion. We will open the public hearing and we'll take input, but so that we have a means to discuss this, we'll get a motion on the floor.
I guess it's a clarification question related
Sure.
to Glenn's.
Okay.
It's more of just, instead of going through that rigmarole, isn't there a process that we could just amend instead of going?
Yeah, I was going to say.
Yeah.
I was just going to say that, Councilman, and that's another. I mean, of course, in an ideal world, I could come up with a nice piece of paper with four corners, and it could have present something in the next day or two. But you could also just take it upon yourselves at this meeting and make motions to amend the current ordinance that would be in effect immediately.
And then that would be questionable as to if it was a substantial change? Would
No, the language in the ordinance allows us to change this by resolution, so it goes into effect immediately. So
Okay.
Tonight at this meeting, you can make motions to amend the language of the ordinance that go into effect immediately.
Okay. Is anyone willing to make a motion just to have something on the table to discuss?
I'll make a motion.
Okay, Councilman Helene? Just to...
I want to make it clear. I'm just making it so that we can discuss it, because if no one makes a motion, we can't even discuss it.
Right, so your
And
motion
I will-
is...
Yeah.
as it is.
Lallam will second it.
Lallam, so Holing made the motion and Lallam second. Now,
Just to make sure I understand, Reed, your motion was to keep the current ordinance in effect as is.
Yes, because now I will preface it. I'm actually not really in favor of that, but we need something to discuss. So,
right, yes,
because
that's what I
we
wanted.
we can't even talk about anything until we do this.
Right. Okay, so now we have a motion and second on the floor, and I will go ahead and open the public hearing and see if there's anyone who would like to speak on this matter. If so, please unmute your microphone and state your name and say permission to speak.
Hi, Mayor. This is Liz Christensen requesting permission to speak, representing the Boys and Girls Club.
Okay, go ahead, Liz.
Hi, thank you for your time. I'm representing a coalition of community members who are working together to put some child care options into place to help our emergency or our essential workers in Watertown. We've had a few different meetings and most recently surveyed all of the healthcare workers in Watertown. And there is some need for folks, to have some help who work in those areas. So my question is, with the Boys and Girls Club being one of those locations, we are a, city-owned building and, are closed to the public, perhaps. And I guess I wanted to open it for discussion if there was an option for the Boys and Girls Club to open our facility for some child care during this COVID time, even with the current resolution.
Thank you, Liz. And it was the resolution that closed the city businesses, and that's the next item on the agenda. But
okay.
That's fine. I mean, you made a very compelling case for that, but the ordinance doesn't affect the Boys and Girls Club operation.
Okay.
And am I right, Matt?
Yes, that's correct.
Yep. Okay.
Okay.
But,
so I should wait till, I'm sorry.
No, that's okay. That's perfectly
the right
fine.
section.
That's perfectly fine. Thank you. Anyone else?
This is Cindy Midland with Sanford Clinic requesting to comment.
Go ahead, Cindy.
Thank you, Mary Karen. We had our Unified Command meeting this noon, at 1 o'clock, and this was discussed. Councilman Vilhauer asked if I would be willing to make some comments on behalf of the healthcare community, and it was discussed by all the participants. And asking for input from the healthcare community, the Healthcare Unified Command, which has representatives from Prairie Lakes Hospital, Brown Clinic, and Sanford Clinic. I am clinic director for Sanford Clinic, but speaking on behalf of the healthcare community. There was total agreement that it's too early to open or relax restrictions on certain activities that are contrary to social distancing guidelines. And how you interpret that to each individual business line is up to you. But not only is what we're doing working as far as social distancing, but we don't yet know the implications of several moving parts. For instance, Easter was just over a week ago. We know some families have gathered from other areas who hadn't been together for a while, and the 14-day incubation period hasn't passed. As we all know, there's a significant outbreak in Sioux Falls. And just today, the Worthington pork plant has been shut down due to an outbreak. There have been a few positive cases north of us, even though our region has been very, very good and not had any additional positives. And there's also been anecdotal evidence that Sioux Falls area residents are nervous about shopping for essentials there because there have been positive cases in several retail stores. And they've driven to Brookings and Watertown to shop. So, we're not like Minnesota. We don't have a travel restriction, so people can easily commute or travel, and it could spread. So I'm not saying it's going to be a huge outbreak, but I'm saying it's too soon to see how all these things play out, because each of these situations, and there may be others that pop up, will all have some sort of ripple effect, and it's too early to know how much of one and how far it'll extend geographically. Having said that, I don't think it's a bad idea to start talking about what preventative practices need to be in place for limiting for a limited reopening of certain businesses, for obviously you guys to decide. And those businesses could present their own proposed precautions or conditions for operation. I'm certainly supportive of the Boys and Girls Club for childcare for healthcare workers with precautions. Healthcare workers kind of have been somewhat discriminated against, and I understand it. There's a lot of fear and concern. So there's been a lot of healthcare workers who have had their children, I hate to use the word, but kicked out of their regular daycare because of fear, and I get that. But we probably are closest to it in being very cautious. So I'm supportive of that, but there probably needs to be precautions with that also. But Dr. Dan Riefenberger, Prairie Lakes Hospital, Sanford Clinic all agree that it's too early to throw things open at this point.
Thank you, Cindy. Appreciate that. Are there others who would like to speak? If so, please state your name and request permission to speak.
Madam Mayor Manty.
Councilwoman Manty.
I just wanted to piggyback on both of these topics. Childcare has been something that's been on my mind, and I was reviewing the ordinance, and I don't see any specific reference to it unless I'm missing it, Matt. So is that something, I know with kids, I have some friends that have been put in kind of a real tough spot with the kids being homeschooled and some of those type of things, or like Liz, or who was it? Anyway, one of you said that, people are getting kicked out of their daycare or whatever. And that was one of the things I wanted to bring up tonight is there are other cities and other states, even Minnesota, that has a travel ban that's allowing some of their daycares to stay open for that purpose. So I just guess that's bringing it up now because it seemed like a good segue with the comments that we just had.
Okay, thank you. We did not close daycares with the ordinance, but private daycares have the ability to close themselves to patrons. Are there other people that would like to speak in the public hearing? If so, please unmute yourself and state your name and request permission to speak.
Dan O'Neill, permission to speak.
Could you repeat your name, please?
Dan O'Neill.
Dan O'Neill. Go right ahead, sir.
Yep. I would like to think the council would consider amending this ordinance to reflect some sort of metric or way to determine, other than just kind of an arbitrary method, more than one or more than 10 active cases in the county to determine if there's an actual health emergency. Obviously, there isn't a health emergency in Connington County. I mean, we have one active case, maybe we've had two over the 4-week period. It seems somewhat arbitrary to declare a health emergency and close businesses when there isn't any cases to indicate you have a health emergency. It would be somewhat more responsible to have some metric in the ordinance that would provide some guidance to the members to say if you're more than 10 or less than 20, something in there that would define what you are declaring as an emergency. But because currently we don't have an emergency. Our healthcare system is completely underutilized. There is nobody in the hospitals. We have no cases. So I'm curious if any of the council members have considered the possibility of putting some metric in there that would aid in this determination, because right now it's really just arbitrary.
Okay, thank you, Mr. O'Neill. Is there anyone else that would like to speak? If so, please unmute yourself and state your name.
Cindy Midland requesting to speak again.
Go ahead, Cindy.
I just wanted to tag on to those comments. It's not arbitrary, and to say we have no cases doesn't mean that we don't have any cases for several reasons. One being that people can be contagious and still be asymptomatic, meaning they don't have any symptoms, and give it to somebody who has a high risk factor and could become very ill. Second of all, we found very quickly that cases like Sioux Falls, Worthington, Minnesota, et cetera, and Beetle County and Huron, that it can take off like wildfire pretty quickly. And just because we don't have any now doesn't mean that we rip off the Band-Aid and not cover the wound, so to speak, pardon the pun. But by the time you have 5 cases, 10 cases, 12 cases, all of a sudden within a week, you've got it out of hand, because 2 weeks later, you're going to have, each person is going to infect 2 to 3 more people. And so you always have to stay ahead of it. And I know this is painful. It's painful to certain members of my family as well. I totally get that are in business. But it isn't that just because we don't have any today, we're safe and we can just go back to the way as business as usual, because that's not the case.
Thank you, Cindy.
Dan O'Neill, permission to speak and follow up there?
Okay, I don't want this to turn into a back and forth, though, but go ahead and you can, please keep it short.
I will. Again, the council has to make a determination. What is considered a health emergency? We can't continue for months with 1 active case, or worried about 1 or 2 active cases, and keep everybody shut down for that. It is not feasible, and it's not recognizable as a way to function. So that's still the suggestion.
All right.
In the comment.
Thank you. Anyone else want to speak? Please unmute yourself and state your name.
Kathy McEnroy, permission to speak.
Go ahead, Kathy.
Okay, I am a business owner, a fitness business owner, a property owner, and a citizen taxpayer. And I do understand there is a health threat due to the COVID virus. And I do understand we do need essential businesses to be open for essential needs. However, for non-essentials, there have been unequal controls put on my type of business and on the other type of businesses that are non-essential. There's been allowed for relaxed or no restrictions on these businesses. And we were never consulted on how we could follow the CDC guidelines and to remain safely open. And we have a 17,000 square foot, 3-story building, and no one even consulted us. And instead, it was just assumed we were a threat, and the city rushed to essentially seize our business to close us. And you allowed other non-essential businesses to be open with no restrictions, while others were quickly passed through as being able to comply with the CDC restrictions and allowed to self-regulate. Even the essential businesses that are currently operating, such as Menards, not to pick on them, but I was there Saturday, they're operating with large gathering places of hundreds of people in a building at one time, and they're touching items and breathing indoors. And for some reason, this is considered safe. As a matter of fact, we never have hundreds of people in our facility at one time, but we are being judged as unsafe. In addition, we sent a letter of our concerns to each and every one of the council members and the mayor and have not had any response or no acknowledgement whatsoever. The United States President states that gyms can now open, and the South Dakota governor has repeatedly stated that South Dakota is not forcing businesses to close. Therefore, Watertown's ordinance is going above and beyond higher governmental authority with this law. Presently, our local economy is being negatively affected directly by this law. Were you aware that this ordinance has already eliminated 2 gyms in town? 1 gym has already permanently closed in the last 3 weeks, and they will not be reopening. And one gym has packed up and left the city. I would ask that the City Council act to repeal this unequally applied ordinance immediately. Thank you.
Thank you, Kathy. Anyone else wish to speak? One last call. If you'd like to speak, please state your name. Okay, I will close the public hearing and entertain some council discussion. Councilman Helene.
Thank you, Mayor. I just wanted to make one comment before we get into the actual discussion of it, and this is for Kathy. With your statement that you sent an email or you sent something to every council member and you did not get a single response. I just wanted to say that I don't think every council member got an email directly from you. I have read your concerns, but they were forwarded from another email address. So the ability to reply directly to you was not necessarily there. So I don't want you to think that none of us have cared or have read it, because we have, and I just wanted to defend my colleagues on the council. We are aware of your concerns. They have not gone unheeded. Sometimes it's not just as easy as, I mean, we heard your concerns. Let's just put it that way. Thank you.
Thank you, Councilman Holy.
Kathy McEnroy, permission to speak.
The public hearing is closed, and I'm sorry. This is a time for the council to discuss, and if one of them has a question for you, then they could reach out to you, but otherwise the public hearing has been closed. Council, any questions or comments? Councilman Billhauer?
Well, I've got a number of comments, but I was waiting for a few more of my colleagues to weigh in first, because I feel I've probably been closest to this, being part of the unified command structure. So I guess if somebody else wants to jump in, I would yield the floor at this point before I make any comments.
Mayor?
Yes, Councilman Holeen.
I guess just for the sake of argument, so that we all are on the same grounds, I would like to hear from yourself, Mayor, and Glenn, and anyone else who from the unified team. I am curious, looking at the guidelines sent to us from the President's administration, the gating criteria are pretty clear as to what you have to satisfy to move into phase one of reopening the economy. And I was just wondering, could someone give us an overview of where we are at? Particularly, they have 3 different criteria for those who haven't seen it. They have symptoms, which means you have to have a downward trajectory of influenza-like illnesses, or stable. Same thing with cases. And then also there are hospital requirements for the care of our healthcare workers and for the patients. So I was just wondering if someone could give us an overview on where we are at meeting those gating criteria.
Well, I can start out by saying even phase one, the very first phase, says you don't move here until you have adequate testing. That's a basic understood premise for moving anywhere. You start with adequate testing. And the big problem is we don't have adequate testing. We are still severely limited, and we can't test everybody that seems to show symptoms. So that's a problem right now. So do you want to add to that, Councilman Billhauer?
That's right. That was the very first comment that came out of, I think, with Dr. Dan Riefenberger's mouth on Thursday or Friday, I think it was Friday, when that same question or topic came up, Reed, is that we just don't have adequate testing materials available to us yet in Watertown.
Otherwise, I really like the idea that it's implemented in stages, and every stage has its own set of criteria which must be met, and a time period that must be undertaken. And I know the governor has wants to do something similar with her own panel of medical experts for our state. And I think it would be, for us to jump forward with the president's and just disregarding that first basic premise that you have to have adequate testing and ignore that. We can't move forward with his until we reach that goal point. And I don't know what the governor is going to say on hers, but she's assembled a panel of medical experts. Our community has a panel of medical experts, and they have weighed in on this. I rely heavily on what the medical community recommends, and they are not interested in moving forward at this point, and part of it is because of that lack of adequate testing. Councilman Hoyer?
Mayor, it's a right-on concern. Some of the struggle right now, I'm sure that a lot of folks have in the state, is that the governor's already said we're at phase one. And we don't have adequate testing. We really don't. I would put to it like any large business we have. If you went out there and started testing, you may find people testing positive. I mean, many people carry it asymptomatically. There's already been studies done on the West Coast where they're actually testing for antibodies now, and they're finding that they had 80-fold the amount of cases that they had, but people never got tested. They never went in. The symptoms weren't strong enough for people to think to get an active test, or maybe they couldn't just get the active test because it's kind of difficult to get tested, as you've mentioned. Some of the struggle that I know that I get contacted about, and that even I see, is that we've buckled down as long as we have, and I'm already starting to see some of our larger businesses in town easing their restrictions. I mean, and again, not to pick on certain groups, but you drive down 212, if you went down there this weekend, it looked like it was Black Friday. Watertown has not been adhering perfectly to social distancing. There's many folks that are still out and about. It's a little bit ironic that we have some that limit 16-year-old and under going into businesses, but they don't do 65 and up, who are the most vulnerable.
Right.
Sorry. But there's just got to be some creative solutions that we can come up with to find some paths. And I really do understand the argument for putting some metrics on our phases and our triggers, because it is kind of tough when we only have one listed active case. And yes, I mean, the public might not realize too that if you're from a different county and you test positive in our county and you work in our county, you're still only going to be counted in the county that you live in. So the numbers aren't always so clear for us what's actually going on locally. And again, without testing, we don't really know either. But I understand where the frustrations come forward, that it's difficult to see treatment of the situation when we have, hundreds of people in open businesses, but then we can't do a socially distanced 10 or less in some of the other establishments. Or, I don't know, for the sake of discussion, even having somebody posted at the front door with a thermometer ready to go, that's not a perfect way of testing, but it's better than nothing. And just common sense of, if you see someone displaying any symptoms, even if they're allergy-like, you have the right to ask them to leave the establishment for the protection of others. So I don't know if we start looking at, is there a step we can take that can open up a little bit of leeway? It's still really restrictive and really protective towards things. I'm not saying open the floodgates, that's ridiculous, but taking a step, seeing where we're at, and then we can always take a step the other direction if we had to.
Yes, excuse me just a minute. Whoever's at the phone number 882-6200, would you please, oh, that's you? If there's some feedback or something going on, if you are on and your microphone is not muted, please mute your mic. Councilman Rademski?
Do we have any idea when we might have adequate testing?
No, and actually I was on a conference call with the governor today, and she was talking to all of the mayors, first and second class cities in South Dakota, and she told us that in her conference, the governor's conference with the president, the states, including South Dakota, are begging for adequate tests. They've given us this nice equipment for testing quickly with no test kits. So we have the machine, but we don't have the ability to use it. And until we can get the testing, we're kind of in the dark. And we are set up, so this will be great once the test kits become available. Things will change, and we'll be able to pinpoint where cases are coming from once that happens. But even the president acknowledges that you can't move on, you can't move up to the next stage without adequate testing. And we don't have adequate testing, so we're stuck until that happens. Councilman Rademski.
Just a few other comments here is, everybody knows about the virus. This has been going on. We've been shut down for so long now. And, just to find out if we can open some things back up, do it in a timely manner, because these people that might be high risk, do we leave it up to them to decide whether they want to visit an establishment that's open? I mean, we can't, always protect people from themselves by some of the laws that we put in place.
Right. That you're absolutely right, and the governor has stated this over and over and over, that we need people to take personal responsibility, and particularly those who are vulnerable. Those are the ones that we're most concerned about. So that has to be an important part of whatever we do, is that people take responsibility to protect themselves. Councilman Albertson, go ahead, please.
I think that this discussion is great. I think the idea of moving it down the road for 2 more weeks is great. I also think that we're going to have to, and I'm hearing what people are saying, we can't deal with this testing situation, but, if we the community continues to do a great job and we don't have a spike of any kind, I think we have to have some serious plan with correlation with the doctors, of course, but have some serious thoughts about what we could open and what would be the least resistance as far as this virus hitting it or something, because, it is our community, and we have been so fortunate in people following the rules that if they'll continue to follow the rules, I would think there isn't any reason we can't start opening it, and hopefully we get this testing. But if we don't get the testing in 2 weeks, will we not have it until July, or will we not ever get it? Because Watertown is not a high priority when Sioux Falls has hundreds of cases every day. So we may not get testing, and so we may never be able to reach that. And I think we should look very carefully at doing some opening really soon. But we want to do it in connection with the doctors, that's for sure.
Right. Thank you very much for that, Dan. And the incubation period takes a couple of weeks. So people who got together with Easter with family and friends from outside the area may have been infected and might not even show their symptoms for another week to come. And then they might not be severe enough to go to the doctor for another week after that. So there's a time lag involved that I think that the medical community wants to give this a little more time to see if we have a bump. And we also have the construction season starting right now. We've got crews coming from other parts of the country to our community, and that too could cause a bump. So it's not that people aren't paying attention, that the ordinance was passed and the council has gone to sleep. People are watching this intently, day by day. Councilman Hoyer?
Right. What measures are those non-local construction teams taking to make sure they're not bringing a virus to us?
Well, the construction companies have a vested interest in keeping their crews healthy. And so what we're finding, and we do have in the incident command, there are numerous branches in that group, and one of those branches is communicating with all of the construction crews that we can find information for. And they've been pleasantly surprised to see they do have, for the most part, a pretty good plan for monitoring their employees and making sure that they're healthy, and plans for quarantining them if they become sick. So we'll see if they actually carry through with it. But this is one of the things that if these people come from outside our area, it may not show up as a Cottington County case. So it might look like we're not having a bump right away if we start having people from outside our area getting sick, until they start infecting the people who live here. And then by that time it could be pretty bad. But we're watching and we're prepared. So that's good.
Here it's Don.
Yes, go ahead, Councilman Roby.
I got drops. I missed some of the public testimony, but I just wanted to weigh in with the following. The people I've heard from, it's about 50-50, pretty impassioned on both sides. Our healthcare professionals are telling us just wait at least a little bit longer. That sways me quite a bit. But I also think that we need to move forward with an architected plan, at least at a high level, how we step into unwinding this. I think that we should not waste any time in getting that plan in place. So as we get more comfortable with the data we're looking at, that we know how we're going to unwind this, at least at a high level. So I think that's something we need to work on, right away at a high level, with the idea of getting that more granular as we go forward.
Thank you. Councilman Hoyer?
The other point that's becoming increasingly difficult to address with people is that, yes, we're at one active case right now. The rules applied before too, but when we had 0 cases in the county, it didn't stop the city from allowing our St. Patrick's Day celebration to still go on with a public parade, with people still going around. It's just, we have to be able to look at that too and come up with something. It seems a little arbitrary, and that's when the arbitrary discussion comes in. What are we basing our stuff on? I understand the mites, and I understand that we should use plenty of caution when doing anything, but there just has to be a level of assessing risk, knowing where our capabilities are. As of right now, according to the South Dakota website, I mean, we've had 2 hospitalizations here. I don't believe they're still hospitalized at the moment. But, if we're sitting with empty medical facilities, I would like to think that we're in a relatively good position to be able to manage any sort of, even if it's just small incremental opening. I mean, again, don't open the floodgates.
Right.
But being willing to take a step in one direction, ease it up, and if we see an uptick, one, we know that we've taken the time to prepare so we can handle a little influx, but 2, if we don't see it, then it can continue for a little bit. But until we start seeing those numbers coming in, it's really difficult to continue forward at the rate we are. And again, use plenty of caution, but at the same time, we should level that with some common sense too. It's hard to say go against a medical professional. I'm not saying that. But when it comes to testing, most of the resources out there are saying that we're not going to see some of those supplies. We're just not. The bigger cities are going to be prioritized first. And so we just need to have some measures that we can hopefully put in place that let us tackle this in an intelligent way with the resources we have.
Thank you. Councilman Vilhauer.
Just to weigh in now, probably repeating some of the same points that have already been said. But first of all, I want to thank Cindy Midland for calling in because I kind of put somebody on the spot today. I just so you know, while you're talking to the governor, I was leading the Unified Command meeting today. And when the healthcare profession came out loud and clear that said it's too soon to act, I said somebody from your group needs to speak to that tonight, and so I appreciate Cindy volunteering to do that. I also want to explain what the Unified Command Team is or isn't. I got the utmost respect for everybody that serves on that group, but please don't let them become a political body whereby people start to lobby them one way or the other as far as swaying their decision as far as what to do with this, because that's not what they're there for. I'm part of that. But I also made it clear to the group today that we're between a rock and a hard place as a council. And I said, yes, the medical profession, you are looking out for the health of the community. I respect that completely. But we also have to look out for not only that part, but also the economic health of our community as well. And I'm very concerned about if we do continue down this road without some changes, that we've already killed some business. There's no doubt about that. And the longer we continue in place with what we've got, we will kill more. I hear completely the concerns about the unfairness aspect of it, that there's businesses out there that can operate under CDC guidelines perfectly great, but yet we shut them down. By the flip side, like you said, Councilman Hoyer, we've got other places that are just, I mean, they're jam-packed practically, and yet they're allowed to operate. That there's definitely a fairness aspect there that concerns me. I would be in favor of loosening. I don't know. I don't want to wait 2 weeks, Dan. I want to take some action sooner rather than later on this. I don't know as we're in a position tonight to make that action. If I would have had to propose a motion tonight, I would have actually proposed a motion to repeal the ordinance that we have in place fall back on the governor's executive proclamation, and then reconvened in short order in a special session of this group to see what we can come up with as far as some in between or some compromise, because I'm not comfortable continuing the way we are. I trust the discretion of the consumer out there. I also trust the discretion of the business owners out there, that they are going to do the right thing. They've got a vested interest too to do things the way it should be done. So I trust our business community. Something else that we have not talked about, I had a conversation with a liquor store owner the other day. Their business is going gangbusters. We're deluding ourselves if we think that people still aren't gathering at different places where they're not supposed to, or if it comes to, for example, consuming alcohol. This is great for the liquor store, so what are we doing to the community now by having people consuming more beverages at home because of the extra pressure that's being put on them because of all the shutdowns that we've got in place. And I'm also hearing from the mental health community that they're concerned about the pressure that's going to be coming towards them because of the restrictions that are in place. So, like I said today with our group, we're between a rock and a hard place on this. I definitely want us to see us do something. I'm not in favor of letting things go for 2 more weeks, because that's a long period of time for a business owner that's already struggling to keep their doors open. So, having said that, I guess I've spoken my piece for tonight. Sarah, I guess I'd like you as mayor. I think you've probably already indicated where you're leaning towards on this, but I guess I would like to know, as because you are the head of that command structure, where you shake out in this exactly.
Okay, I'm happy to say it. I am taking my cues from the medical community, and I'm not seeing them budge at all, and it's a timing issue. And actually, Casey DeBoer, the CEO of the hospital, just now sent me a link to an article in Reuters. North Dakota coronavirus cases spike with outbreak at GE wind power plant. We have wind power plants under construction all around us, and the workers are just now starting to arrive, and we are aware of that. We were poised and ready for it, but we haven't seen the impact of it yet. It's just too soon. But I have no problem whatsoever with coming up with what's going to be our next step, with or without testing. And if the council wants to do that, I think you need to think it through carefully. We in this state took early measures by closing down our schools and our athletic activities, and I think that gave us a big head start. We were closed before New York, and look what happened to them. Of course, we're a completely different state, but Sioux Falls didn't take the action that we did, and they're in a different situation than we are. We were a lot more conservative, and we took action to close down businesses. Sioux Falls did not. And so now the Sioux Falls residents are coming to Watertown to shop because we're clean. But so I do think, yes, we need to make a step forward, and people need to be reassured that this isn't forever. And I don't want this to be forever. I want this to end soon, but I'm very uncomfortable when our medical advisors are telling us no uniformly, that we're not ready to take that step. So I think we could be taking it in the near future, though. Councilman Hoyer?
It's hard to, okay, so our large businesses, large gatherings are still happening, right? We haven't seen the uptick that I would expect to see with that. I mean, we have hundreds of people in some of these buildings at some points, and like I still go to grocery stores. I don't see anyone wearing PPE as a cashier sometimes. How many people do they interact with every day? When we look at Sioux Falls, that was a manufacturing plant that had a massive outbreak because there were a lot of steps not being taken. There was a lot of irresponsibility on that company's behalf with their employees, not looking out for their employees. I would hope that our manufacturing locally is looking out for people and that they're encouraging them to take sick time if they're feeling under the weather and not doing things like responsibility pay, trying to bring people in. But comparing us to that, it's hard to see apples to apples on it. And again, I agree, we need to be incredibly cautious, but it's hard to look at, if you took a space and we do 6 people apart, kind of like, or 6 feet apart, kind of like we're doing right now, how is that different? I mean, I'd still say, like, yeah, we shouldn't do, like, public sports. We shouldn't do parades. We shouldn't do, a 4th of July gathering with a large-scale group of people. But if you're limiting numbers, I don't see how that's different than the people going to gas stations right now.
Right. And I think that the medical community was expecting to see a bump after Easter, because that's a traditional time to get together with family. And it's also the beginning of the construction season, and just wanting just to see where we are before we start backing up. And that's maybe a week or two and not months. So,
but looking at that, why wouldn't we put something within the amendment to be able to bump it back if we have to right away? Give it quick action. If we see an uptick, then cut the head off the snake.
Yeah, the problem is that it's a 3-week time period from when someone's infected until you see them.
Right, and it was
numbers.
The first time too. The first time we had a case, and we inevitably said, it's likely we're going to have 10 more cases. If we have 1 positive, there's at least 10 more.
Right,
and we saw that.
We had our first case before we shut anything down, and then we quickly, the council had a special meeting, shut everything down within a couple of days, and then the cases rose for a while. So
correct, but what stops us from being able to react just as quickly, if not faster, to another outbreak like that?
Well, I'm in favor of getting lined up and ready to move and ready to back up if that's what the council wants to do. I just don't know that tonight is the time to do that. But I haven't gotten a vote on a thing yet.
Right.
So we'll see if there's a tie. Councilman Rademski.
I'd just like to give a shout out to the factories in town that have taken this seriously and the measures that they've put in place to protect their employees. A lot of these factories in town employ hundreds of people, and all these people in each of these factories, I'm sure, don't always work 6 feet apart from each other. And all these factories, once these people leave work, they're going to Menards, they're going to buy groceries, so then they intermingle. That's no different than these same people that would be eating at the same restaurant together. They're sitting in the same casino together, things of that nature. I think we also need to be very mindful of the businesses that have lost business, the businesses that have closed, and I'm sure there's going to be more that probably will not reopen. And I'm also in favor of taking some quick, swift action to open up some of these businesses again.
All right.
Mayor?
Yes, Councilman Albertson, go ahead. You're muted.
Yep. Okay, just to reiterate what I said, at least that I would like to see us have your group that you meet with every day come up with some suggestions. I get the feeling the flavor of doing something soon is on our minds, and if you came with some recommendations for us, because you probably will include the Kathy McEnroys of the world, and not saying Kathy, but somebody like that or several that would say, here's what we could do if you would let us get back into business again. And in 2 weeks, if you told your command group, we're going to probably do something in 2 weeks and we want to do it correctly, I have a feeling that they would come up with something. And I've got so much confidence in our community that I think that if we say, guys, we're going out on the edge of the tree here because they say we have to have testing. We don't think we're going to get it, so we're going to do something, and you got to help us.
Thank you. I think you're right, Dan. And I think the community would take great care if given guidelines. And I'm in favor of doing that and taking that to the incident commanders and let them take a look. But we talked about setting up those guidelines ahead, and they were just thinking it was too soon. And every day that goes by is another day that someone's hurting. And so I hear it. I hear it both sides. Councilman Lallam, did you want to speak?
Yeah, I just had a couple of questions. I mean, what are our capabilities currently with our healthcare system? I mean, have we talked about that? What's the bed counts that are available? What are we looking at? Not that I want to, look doomsday scenario, but what can we handle?
Yeah, we're set up for what we need, and we have the beds identified and the surge capacity locations identified and a plan that's ready to be implemented if we need it. So I think that, we have different phases, like we've got hospital beds, but then we've got surge capacity beds that aren't actually necessarily in the hospital, but would be areas cleared out for expanded hospital if we should need it. So we're in good shape to handle the surge when it comes. And the surge is not expected to be here until June.
Okay. Well, when we're talking about flattening the curve, what we're trying to do is give the healthcare profession time to, prepare and things of that nature, so that they are not overridden with an immense amount of people that come in. And I think that what we did right away was probably the right thing to do, to get that, to give them the time to be able to handle what they needed to on their end. To Cindy's point, yeah, we have one, and one's frankly too many, but we're going to have that no matter what. We're going to have people that are going to get this. This isn't going away in a month. And if we're talking June, we, instead of having a couple businesses closed, we might have 30 businesses closed. So, I mean, those are the things that we fall into as council members and my colleagues that are sitting there in the room and at home. We're obviously taking the social distancing pretty far on that. And I think the people that go out and, or want to go to these establishments and the owners, I think the owners will do their best due diligence to try to keep everything clean. They don't want anyone getting sick either. It is a tough situation. I don't have any idea as to, what kind of time frame we're looking. Frankly, I don't think we can go till June. Is it Monday? I don't know. I mean, is it a week from Monday? Is it 3 weeks? I mean, that's what we're trying to figure out. Our ordinance actually expires, and Matt, you can jump in here. I believe it's the 21st.
23rd, I think.
23rd. So I mean, it's coming
Okay.
up sooner rather than later anyway. I mean, maybe we set parameters in there to Michael's point is, maybe if we get to 10 cases within a certain time frame, we have to relook at that. I know that 10 cases usually doesn't mean just 10 cases either. That's kind of one of those, the number's typically higher than what the number is because you got people that will not, frankly, go in and get tested. So those are some of my questions I have. It's not an easy decision. Whether we reopen or not, we got to give some of these businesses at least time that maybe have furloughed employees or, frankly, put their employees on, they've let them go. Got to give them a little bit of time to bring on their employees back on if that's the case. So those are a couple of my comments. Just kind of wanted to hear what you guys thought after that.
Madam Mayor, it's Beth Manty.
Yes, go ahead, Councilwoman Manty.
Just a couple comments. Listening to what everybody's been saying, I guess that I don't want to repeat what everybody's already been saying because they all have points I want to make. When we talk about the potential Easter surge and some of these other things and the expiration of our current ordinance, the governor's guidelines, I would suggest that we don't go more than a week. That would give us the 2 weeks or whatever it is, the 14 days that we're looking at for the potential Easter bump. We will have a lot more information as to what's going on a statewide level as well as here. And then I think moving to the governor's guidelines, and I do agree with everybody who said that I don't think our businesses want people to get sick. I think our businesses will be responsible. The ones who can't make the accommodations are going to say, hey, I can't make those accommodations. The ones who can think,
what you're talking about.
what are you?
Yeah, go ahead, Beth.
Oh, somebody else has got their microphone on, so they're stepping over me. So whoever's got microphones on, not you guys, please turn them off. Anyway, so go to that 1 week period. Our ordinance sunsets on Friday. We call a special council meeting or whatever we need to do. I think that we go to the CDC guidelines that the governor set, of her resolution. Then we create, we can be thinking about this, your team can be thinking about this. What do we do to give our, this is what we have to see for us to go back again. And I think people would be very willing to do that to keep the community safe. But I just really think that we need to give people a little bit of hope, a little bit of glimmer. I think, like Adam said, they need to know when to start bringing their people back online, when to start putting inventories back in place, some of those things. But, I can hold on for a week, but I'm not going to hold on for 2 weeks or longer. I'm not going to wait till June. I'm saying this personally as a council person without getting pretty firm about what I feel about this. So that's my suggestion, is to wait the week, look at our ordinance. What do we want to do? Do we want to reinstate it? Do we want to change it? Do we want to go right to the governors? And then what do we see as being the metric for why we would throw them back in to restrict them more? That's
Okay. Thank you. The week, you mean to be the 2 week period from Easter? Because the ordinance doesn't expire until May 23rd. I'm not sure if you misunderstood
I was
that.
thinking it was April 20. I meant another week so that we've had the Easter 2 weeks.
Yeah.
I'm talking about a week, not the sunset of our ordinance. I'm talking about the Easter 2 week, but we can certainly do something before the ordinance sunsets, or we can modify it, or we can choose to, throw it out, do the governor's guidelines. But I think that people would be very happy if they could at least see some light at the end of the tunnel, or be preparing for us to open, and then we can do it quite quickly. But I think as fast as we shut down, we could do it again if we had to. I mean, we've proven it. We've proven that we can say, yep, this is not going good, boom, shut her down. But I think we need to give everybody a chance to see if they can work within the governor's guidelines. I can wait a week, and that's okay.
All right, thank you, Beth. Other council members?
Mayor, Bruce Bueller here.
Councilman Bueller, go ahead.
Thank you. Just a few comments. Just want to kind of go over a few things that I have ascertained from this discussion. And, I have tremendous empathy for those businesses in town that are hurting. And I think it's important for us, combined with the unified command, I think we need to work together to put together some sort of a contingency plan on how we're going to roll this out for different types of businesses that are shut down currently. I have to take a lot of stock in what our medical professionals are telling us, and the fact that we do not have sufficient testing right now. That's a big concern to me. And also, I think something we need to take in consideration is, if this gets away from us, we're putting medical professionals' health at risk, because they're the ones inevitably they're going to have to deal with this problem. And again. I believe the governor said that 30%, the expectation was 30% of us will get the virus, if I'm not mistaken. But they said 80% of those people would be asymptomatic. So again, a lot of folks can be walking around with this virus, and it doesn't take a whole lot to get a whole lot of people infected, I don't believe. And so I do think that it's important for us to plan, and I mean right now. I think it's important right now that we start planning on how we're going to move forward with the businesses in our community so that they can start back up. I really feel for these folks that are out of work and these businesses that are suffering like they are right now. But the health of our citizens has got to be paramount in our decision. So I do like the idea, unified command, and and the council working on this and planning as soon as possible for some sort of a modification to the restrictions that we've got on our businesses. Thank you.
Thank you, Councilman Bueller. Councilman Hoyer?
It's kind of the last thing for me, but just two fears. One, if we create a prohibition, it just goes underground. If you stop them from doing things that they're going to do anyway, they're just going to do it in a more dangerous way. You see that with people that are underage. You see that with multiple things. And I don't want to think that our citizens do that stuff, but I know there's been people that have gathered for parties. I know that stuff's going on, and it'd be almost safer in some ways to put it in a controlled environment. And then the second part is this is going to go in waves. I don't see a smooth, pretty line the whole way. There's going to be ebbs and flows. We're going to have ups and downs. So I would expect as we go forward that we're going to see a period where maybe we do pull back, but then we'll ease up again. But I don't think it's going to be a linear path. And I think we have to be understanding that this is going to be a dynamic situation the entire time we deal with it. But that's kind of my last piece on it. I agree with Beth. I think a week out is a good amount of time to see if we see the bump. And if we don't, I like Councilman Bueller's point that we work together and see if we can find a path that meets in the middle, because we're going to see people go under. And when people start going under, we're going to see mental health issues start to happen. And when we see desperation, it can spiral. And we don't want that. We need a path that works, that has moderation and some wisdom to it too. So we got to find a difficult but doable path in all this mess.
Thank you, Councilman Hoyer. Councilman Holeen?
Thank you, Mayor. I just, before I get to where I stand on the issue, I would like to say thanks. I love living in Watertown. I think we all do, because this community has really rallied together to do what needed to be done. It's been fantastic to see us get together and just accomplish a lot of things. I think that's fantastic. And I also want to thank all of the people, because we've always kept it civil as well. In this discussion tonight, over the last couple of weeks, what we've heard from people, by and large, everyone has been very civil, even if we disagree, because we can understand the arguments on both sides. And I wanted to thank everyone. The Unified Command team has been fantastic. I've watched your briefings. I really liked what Mike Cartney said today, where he said he's praying for the decision makers, because we are going through unprecedented waters, and we're just trying to find a way. We all know what's at stake. It's grave concerns on both sides. So we're just trying to find a way, and I would just ask for continued respect for all of the decision makers. With that said, I will also come out in favor of repealing this, going back to the governor's guidelines. I would say if we want to give it a week, I'm okay with a week. I would be okay with even being a little bit more aggressive and falling back to the governor's guidelines. I also would urge the Unified Command team to look at Watertown-specific businesses. I'm thinking like the beauty salons, hair barbers, and things like that. As long as the barber has the mask on and they're the only ones touching their tools and they disinfect between clients and things like that, and you limit, like one person, social distancing still, I think that there's a way for business owners to work with the city of Watertown and for all of their patrons. It's in everyone's best interest to keep everyone healthy, and I think that we've got to trust people's personal responsibility for that. Unfortunately, you can't trust everyone's personal responsibility, because people will violate it. Even otherwise intelligent people will go underground, as Councilman Hoyer just said. And then there are people who, even if you passed a law and made it illegal and you'd throw them in prison, they'd still go out and do this. So at a certain point, for all the law-abiding, intelligent, socially distancing people in Watertown, I think that we need to get this city going again. So respectfully, I understand the concerns of the medical community, but part of my concern is the unknown. I don't know when we'll ever get the testing capabilities. It might be months out. And I also understand that you have the Easter bump. Well, pretty soon it's going to be Mother's Day bump. Then it's the construction bump. Then it's the 4th of July bump. How many more bumps of people getting together are we going to have to go through? I mean, we could seriously shut down the economy for 2 years before we 100% feel that we're safe to go back to work. At a certain point, you have to just vote, and I will vote to repeal this, I'll say a week, and fall back to the governor's guidelines and hope and pray we've made the right decision with the ability to come back fast and reimpose some regulations. Thank you.
Thank you. Are there other council members who haven't had a chance to speak that want to speak? Okay, so we have a motion on the floor.
And that motion is to continue what we've got in place until our next meeting, correct?
Right?
Correct.
Mayor, this is Don.
Councilman Roby, go ahead.
I'd like to throw up maybe the consideration for an amendment. If we're going to continue with the resolution, I think we need to put our plan in place how we're going to unwind out of this. And if it's just to follow the governor's guidelines, okay, that's a plan. And do we want to consider other factors? I'd put that out for discussion.
Thank you, Councilman Roby. Councilman Lallam, did you want to say something?
Well, I just had a question. We're voting on whether to appeal or repeal this. If we wanted to make an amendment, I think either way, to Reed's point, we wanted to make an amendment to next, so it goes till next Monday, per se, as a week out, like we've talked about. Do we have to actually amend our original motion? And then to Don's point, if we want to make some guidelines and/or would we make an amendment to the ordinance or to how do we get this into effect, or something along those lines? Just kind of more some clerical. What are we going for on this, and then how do we move forward with it? Maybe that's more for Matt.
Mayor, Don, another quick point.
Go ahead.
If we're going to vote on it right now, just based on what the medical professionals would tell us, I'm going to vote no. In other words, we continue as we are. But I'm willing to look at it again another week. In other words, I don't think this is something that we're just going to, it's got to be kept in front of us. I think I'm willing to go another week just because of the medical professional recommendations. But I'm not saying we won't. I mean, I think we need to think about this through the week, and we figure out how we're going to unwind or back these things off, and then be ready to consider it in another week. I think this is a real-time thing we're going to keep looking at.
Mayor, this is Matt.
Yes, go ahead, Matt.
So to Adam's point, I think what you could do, just a suggestion, and maybe to Don's point as well, you could amend to the original motion to Don's stating that he would vote no. That would actually discontinue the ordinance. So the motion was to continue, just for the clarification there. But what I would suggest, if you want to revisit it in a week, you could amend the ordinance expiration date to a week from today's date, thereby forcing you to reconsider it again at that time. And at that meeting, I can have something drafted that would be a framework that the council could consider at that time. Now, at that meeting, the council could say, nope, we saw a spike over the week. We're going to keep the current ordinance in place and extend it. We're going to table or postpone action on the proposed alternative. Or you could say, you know what, we're going to go ahead and repeal the current ordinance and put in place this alternative. And the alternative is really going to look like a lot of what the governor's executive order looks like, with the exception it'll give us the ability to enforce some of those directives. So again, if there's reports of large gatherings of people in violation of the CDC guidelines, the police department can enforce those directives with either a nuisance abatement or a citation or both.
Mayor?
Right. Thank you. Councilwoman Manti, was that you?
Yes, it was. I think we're all circling in, for purpose of kind of getting this going, I think we're all circling in on that 1 week timetable. I think Matt's idea of amending the sunset date on this is a good one because it holds our rules in place. We have a lot more information in that week. And as he said, we may say, nope, we got to keep going and we're going to extend it. Or we've already thought about what we're going to do during that week to Don say, spin us out of this in a very thoughtful way. We know, like I said before, we know we can back it up fast if we see people grossly abusing it. But I think that's where I'm at. I didn't make the original motion, but I think that a week seems to fit everybody's comfort level. I know everybody's looking to move the economy along, but yet respect what the medical community is saying. And I think an amendment and a week, revisiting in a week, works for all of those things. That's just my opinion.
Okay, thank you.
Mayor, Dan Albertson.
Councilman Albertson, go ahead.
Unless you were to tell me that the Unified Command is going to be able to help Matt do this, I would not be for that, because I believe that we're putting our medical people in dire potential of being in trouble. And if we don't count them in on this whole conversation, and I'm for doing something, I want to open this up, but I don't want to do that and look at our doctors and say, you know what, I know more than you do, because I want them to be a part of this and tell Matt what to do. And I think in 2 weeks, they're going to be able to tell him more than they'll be able to tell him on Tuesday and Wednesday, so we can meet again next week with something coming from him. So unless you say that you think the command would be able to do that, I would be against that amendment.
Well, 2 weeks would land it on another meeting night. If we did 1 week, we'd have to have a special meeting. Matt?
I just was going to say that I would absolutely, anything that I would put together would be vetted through the medical professionals. But I will say that what I'm envisioning at the moment basically is going to be very, very similar to what the governor's executive order is. So if anybody wanted to get a head start in looking at that, they could do so today. And I will say that the governor, of course, is advised by a slew of medical professionals as well. So I just want to make sure that there's that consideration.
Thank you. Councilman Billhauer?
And just to clarify, Dan, or to the council, that Matt does sit in as part of that unified command team every day on the daily briefing. So it's not as though he'd be operating in a vacuum aside from the command team.
Right. Thank you.
Mayor, this is Don.
Councilman Roby?
I sense a lot of indecision. I'm part of that indecision on this one, but I'm okay planning for a special council meeting a week from now. This is extraordinary circumstances. I just want to make sure we get our head around it. And I think the fact that we have something coming up in 7 days, an impending event, if you will, I think we're going to get a lot of discussion, good discussion over the next few days, and really, really try and figure out how we want to do this.
Okay. Thank you. Councilman Vilhar?
I would definitely endorse the idea too of a special council meeting next Monday evening, or I guess probably the evening would be my guess.
Okay. Councilman Lallam?
Mayor, I'd actually make the motion to amend, if possible, and Matt, if you can help me through that, to put the sunset date as of the 27th at midnight. Would that work? Or 11:59 on our current ordinance?
Yeah, it makes sense to me. Yeah.
Is that the correct way of doing it?
Yes, sir.
Okay, thank you. That would be my motion.
I would second that motion, Mayor.
Okay, we have a motion, an amended motion by Councilman Lallam and seconded by Councilman Y. And we'll need a roll call. What? Oh, yeah, we can have a discussion on that. Go ahead.
Thank you. I just wanted to, this is Reed for those of you who aren't seeing me, but I made the original motion and I would have made this motion, but Adam beat me to it. I will support this motion to have it sunset in a week. I think that's the right thing so that people can start planning. And I also really think that Councilman Roby had a great point, which is to know that this is coming up will spur some Watertown-specific debate. I do want to hear from some of these people, like Kathy, who spoke about her gym. I want to hear what some of her ideas are, and maybe some of the other workout facilities. How are they going to protect their people and the city of Watertown? I think they can bring that forward. I think other businesses can as well. Give business owners and the people of Watertown a chance to come up with a good plan. So I am in support of this, and I hope it works out.
Thank you. Any other discussion? All right, then I'll look for a roll call vote. Oh, this is on the amendment. So first we'll vote on the amendment. Kristen, will you do a roll call vote, please?
Mayor, would you please clarify what we're voting on, just so
Okay.
everybody's certain?
The motion is to sunset the existing ordinance at 11:59 p.m. on April 27th. And after that, well then, this isn't part of the motion, but the governor's executive order would be the rule if no action is taken. Or we'll come up with a different ordinance, right? Did I get that right, Matt?
Yes, that's
Okay, now we'll do a roll call vote. All those in favor signify by saying aye. All those opposed signify by saying nay.
Okay. Albertson?
Nay.
Okay. Bueller?
Aye.
Boyer?
Aye.
Lean?
Aye.
Was that me? I'm sorry, I didn't hear you.
Yep, Lallam.
Oh, aye.
Okay. Manti? Aye. Rademski?
Aye.
Roby?
Aye.
Billhauer?
Aye.
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 9-1, motion carries.
Okay, so the motion is amended, and the ordinance as it now stands is will expire next Monday at 11:59 p.m. So we'll vote on that unless there's discussion. Is there any discussion on that? All right, Kristen, roll call
Before
vote.
we,
Oh,
Mayor,
go ahead, Councilman Albertson.
Mayor,
Yes.
before we get into that, trust me, I'm for this, except forcing it within a week when 2 weeks is not very much longer to, in my mind, do it right. So I'll be voting against this again.
Thank you,
And
Councilman
please
Albertson.
clarify what we're voting on to make sure everybody's certain.
Okay, the motion is for the ordinance to continue in force for one more week and to expire at 11:59 p.m. on Monday, April 27. All right, any other discussion? All those in favor signify by saying aye. Those opposed signify by saying nay. Roll call vote, please.
Albertson?
Nay.
Bueller?
Aye.
Boyer?
Aye.
Pauline?
Aye.
Lallam?
Aye.
Manti? Aye. Rademski?
Aye.
Roby?
Aye.
Billhauer?
Aye.
Y?
Aye.
9-1, motion carries.
All right, thank you. Item F is review of the continued necessity of resolution number 20-15, declaring an emergency concerning the pandemic outbreak of the novel coronavirus, COVID-19, and providing for responsive measures related to the operations of the city and the protection of public health. we've already had one person weigh in on this. There's not a public hearing, but I would invite anybody that wants to speak on this and is on the line that I would give them the opportunity. Look for a motion so we can discuss it. So Councilman Holeen, is there a second? Second by Councilman Vilhauer. And as I said, we've already had Liz Christensen of the Boys and Girls Club asked us to revisit the idea of all city buildings being closed because they would like to use the Boys and Girls Club, which is a building the city owns, to be available for some child care purposes that are beneficial to our community in our fight against COVID-19. And there might be others who would like us to change that provision in our ordinance, which closes all city buildings. And I would say there are several. So the museum is closed. We don't manage that. The Boys and Girls Club, which we already spoke about, the Senior Center, which is a city building that we do not manage. So in general, there are multiple buildings that we don't manage that were affected by this negatively. Council comments? Councilman Hoyer?
There's a part of me that really feels like this needs to be looked at case by case. I would understand that many of these organizations will likely, like Senior Center, for instance, would likely continue to not be open off their own choice just for the safety of their patrons. But it just seems like as people come towards us, this might be something that we discuss. I absolutely think that the Boys and Girls Club proposition makes 100% sense. I think that's only a positive thing that can come of it.
Meals on Wheels are going on.
Right, and I just mean that the elderly aren't in the building with them since they are high risk.
Mm-hmm.
But Meals on Wheels, again, I think that's kind of an essential thing for the community right now.
Absolutely. Right, thank you. Others? Councilman Vilhauer?
Okay, I think definitely with the Boys and Girls Club situation, I would be in favor of that. From a practical standpoint, would we not be reviewing this at the same time next Monday at our special council meeting, as far as this resolution as well? As far as, I mean, whether or not we want to strengthen it or loosen it. So I guess I would encourage us to take action relative to the Boys and Girls Club tonight, and then revisit the overall issue again next Monday in conjunction with the ordinance that we just got done kicking around.
And I think we need to also visit the Senior Center so that Meals on Wheels can be not operating against our resolution.
Okay.
Which they're operating against our resolution, and I think that's okay. I don't think any of us intended that. And
Yeah,
if we,
Mayor?
Yes, go ahead, Matt.
I was just going to say, so any business that is operating out of a city-owned building would still be subject to our ordinance as it relates to business closures. This resolution was intended to be merely a housekeeping resolution to formalize the closure of city buildings to the public, which the mayor really did the night before the council actually took action. And so I guess I would suggest an amendment to the resolution language that we basically just changed, instead of city buildings, we just add city operated buildings or something to that effect, because if we it just cleans it up a little bit. So if next week you decide to put in the ordinance that all heritage museums have to close, they would still have to. But this just cleans it up, that this resolution simply applies to the city operated buildings being closed to the public.
So one word, just add one word is what you're suggesting. We would clean that up. And who just...
Mayor, this is Don.
Councilman Roby, go ahead.
Matt, are you making a distinction between city buildings that are owned by the city and managed by the city, and then the other one being city buildings owned by the city that are not managed by the city?
Correct.
Right.
So explain, just make it clear, again, it's tough to pick up stuff on the wire. Just make it clear what the change is trying to do from the original resolution.
So the original resolution just basically said that city buildings are closed. And it was, I think the intention was when we passed it, we had in mind buildings like City Hall and the like. But unintentionally, we also own other buildings that have been mentioned here tonight: the event center, the senior center, the Cottington County Heritage Museum, that could be interpreted that they were affected by that, even though I'm not sure if it was the intention or not. And so the suggestion would be to make it clear that it's city-operated buildings, and then the folks that operate out of our buildings that aren't city employees, aren't city business, they would have to make their own determination of, as far as opening and closing, unless they were subject to the other ordinance.
So the key consideration is buildings that are city-operated.
Correct.
Thank you.
Right, so that's the insertion of one word. Councilman Rademski, did you want to pipe in?
Yeah, question I have now, does the Boys and Girls Club operate as a business then?
Well, it's a nonprofit business. but-
Okay, so then the other thing is, are they going to be able to comply to the CDC guidelines?
Well, yes, I think they will. There are child care facilities that must go on. They're a necessity, and so there are special guidelines just for those type
Right,
of,
I understand that, but like in a private one, you probably have, how many kids in a private one versus hundreds of kids at the Boys and Girls Club.
Yes, we haven't heard the plan, and I don't think it's their intention to open it for business as usual. And Liz, if you're still on, I would like for you to add to this. She may have already left.
Yep, nope, I'm here.
Oh,
Mayor
okay.
Karen, thank you. Yes, Jason, just to answer your question, we fully plan to operate, with under CDC guidelines, city guidance, state orders, with all of our operations. I mean, this includes a lot of safety and security measures, including screening before the children and parents would come in the building, personal protective gear, sanitation and cleaning processes, all of our staffing operations that we lead out with will, of course, have safety and security, in our first priority. So we'll take guidance, from a lot of the agencies here in Watertown to help us lay out that plan. But very cognizant that we need to have a little bit of time to plan. If I could just talk a little bit about the need, it's not hundreds of youth, and this would be operated very differently than a normal Boys and Girls Club operation. We've had about 40 surveys that were returned here in Watertown, and we're looking at surveying ages kindergarten through 6th grade, and there was about 30 youth members that have a need to utilize our facility. So
All right.
It's not hundreds by any mean right now.
Thank you.
Thank you for that clarification, Liz.
Yes.
So is there other input by the council? Is there,
Mayor?
is that Councilman Roby?
No, it's Councilman Lallam.
Oh, Councilman Lallam, go ahead.
Should we be amending this versus,
Yes.
approving, non-approving? I mean, is that really what we should be doing, is going back and amending it, correct?
Yep. And this was just a resolution, so there's no second reading or anything. And I think that by changing the one word, it does change the meaning. And if there's anything else that the council wanted to change on that, you could add that in. But right now, that's all I'm hearing is the one word.
So I don't know if the original person that made the motion wants to amend or,
Councilman Holeen.
I mean, I can. Who made the original?
Councilman Holeen.
Thank you, Mayor. A question for Matt. Matt, could you give us an idea of all of the buildings? I mean, perhaps not every single one, but if we amend this, I know Boys and Girls Club, Event Center, Senior Center are city-owned buildings run by another entity. What other buildings? The museum? What other buildings or entities are we talking about here?
The four you just listed Councilman Holeen, are the ones that come to mind. The fifth one that also comes to mind is the golf course building. Levi, who operates that facility, is an independent contractor. He is not an employee of the city, so that would apply to that building as well. But of course, that building is unique. They are a restaurant, therefore they would still have to comply with our ordinance. Similar to the event center in Minerva, they still have to comply with our ordinance that relates to no on-site on-sale patrons. So, but those are the five that come to mind, unless anybody else.
Matt?
Yeah.
Matt, what about the transit?
Yep.
That would be another one.
I can't think of any others.
Mayor, I guess I'd kind of like what Councilman Roby said in the previous discussion. I would like to provide the unified team some flexibility for dealing with this on a case-by-case basis, because the transit is going to be a completely different business unit than some of these than like the museum and things like that. So I don't think, I would like to give you, Mayor, just as I trust business owners to look after the health of their patrons, I trust the mayor and the unified team to make decisions on a case-by-case basis. So I would urge some flexibility with that, which I think that this would allow, but I just want to make sure that that would be the case.
Are you wanting to add another caveat into the resolution?
I guess I would like to.
Yeah, okay.
I would second that.
Okay, so, and not put in the extra word of operated, but instead add a sentence to allow for modification on a case-by-case basis by the mayor and the unified command team?
I would say so.
Okay. So
Can I say something real quick though?
Sure.
The only issue with that is that if next week we say restaurants are open for business, and but Minerva's still has to come to us on a case-by-case basis every time they want to have somebody come in their business, that doesn't make a whole lot of sense. So I'll just throw that out there.
I guess I see a little bit of a distinction. I'm sorry to interrupt if anyone wanted to say something, which is I understand that distinction, but they're still operating out of a building that someone else owns. It would be the case of a restaurant. Let's say if someone was operating a restaurant out of a building someone else owned, it would still be that the person who owns the building could go to the restaurant and say, look, I don't want this. So I have to consider this on a case-by-case basis. Let's say if there's a real estate person who owns 5 different restaurant buildings in town, they would probably consider it on a case-by-case basis too. So I understand what you're saying, but I'm not. But you're the lawyer. You tell me if I'm wrong on that one.
Well, no, I'm not saying there's no right or wrong. I just want to point out the potential issue there. I mean, there also is, we have leases with these people as well, and so, in a sense, we're kind of controlling their business, even though our ordinance, and on the other hand, says that they can be open and operating. The transit, for example, there's nothing that prevents them from having the public in and out of their building all day long in our ordinance. But now by resolution, because we happen to own the building, we're essentially amending the terms of the lease. So I just would throw that out there as a cautionary tale here.
Yeah.
So is there a way we could clear that up?
I think that
Councilwoman
I understand what Reed's saying, but sorry, this is Beth, but I think to Matt's point, and I think we need to be aware of that. When he gave the transit example, that's when the light bulb went off for me. And I think we go back to amending it with our word of operated versus owned and operated. I just think it's cleaner.
Right, and there aren't that many. I don't think we've, you know, it's possible we've forgotten, but no one has reached out to me. And, you know, in addition to these 6 that were brought up, and they're for the most part operating, except for, I don't think the event center is. But the other ones all have come to me right away, and I didn't realize the impact of it. And I'm not going to shut down Meals on Wheels, you know. And the Boys and Girls Club came and said, can we do this? And I said, because I learned about the Meals on Wheels, I know there's a problem, and we can fix it with adding 1 word. I don't think it's like there's 12 more buildings that will come up that, or that we would want to interfere with the operations other than the ordinance permits. But we do have an amendment and a second that's on the table. So that amendment was to allow leeway by the mayor and the unified command team to give exceptions to the resolution on a case-by-case basis. So Holleen made that motion, and I can't remember who seconded it.
Albertson.
Oh, thank you. Any other discussion?
Mayor, just to be clear, is this an amended motion? I keep getting lost in the second
Yes,
of the amended motion.
this is a vote on whether to amend the motion or not in the way that I just said, to allow leeway.
Okay, so instead of it being just city buildings that are operated by the city, this is going to give the decision-making power, authority to the unified command team as to which buildings get that privilege.
Right. And the unified command team has never voted.
All right, I'm not for the case-by-case deal. I think it's cleaner if it's an operating, if it's not operated by the city. I think that's got a clear delineation. I don't see the scenario where a case-by-case, I don't know. I would be in favor of the operating, or the city not operating the building. That's clear. And by the way, that was the original motion, or was there an original motion?
That was the original motion, and the motion,
Okay.
there's a motion to amend the motion on the floor. So we'll vote on the motion to amend the motion first, and if it passes, we'll vote on the amended motion. If it doesn't pass, we can vote on the original motion. So, any other discussion before I get a roll call vote on amending the motion?
Okay, I'm not sure I understand where we are now with this.
We're amending the motion to allow case-by-case exceptions to the resolution by the unified command team.
Okay, okay.
Yep. Okay.
Okay.
Are we ready?
Yes, go ahead, Kristen.
Okay. Albertson.
No.
Bueller.
No.
Hoyer.
Nay.
Pauline.
Aye.
Lallam.
No.
Banty. No. Rademski.
No.
Roby.
Nay.
Billhauer.
No.
Bly.
Nay.
Okay, 9-1, motion failed.
Okay, so we still have a motion to just, actually, the motion now is to leave it alone.
Correct.
Yep.
So, if someone wants to make a motion to add that word.
I would make that motion to add city-operated buildings.
I'll second.
Okay, we have a motion by Vilhauer, second by Hoyer. Any discussion? All right, all those in favor signify by saying aye, and those opposed signify by saying nay. Roll call vote, please, Kristen.
Okay, Albertson,
Aye.
Bueller,
Aye.
Hoyer,
Aye.
Lean,
Aye.
Slalom,
Aye.
Manti,
Aye.
Dembski,
Aye.
Roby,
Aye.
Billhauer,
Aye.
Y.
Aye.
Motion carries.
Okay, so the motion has been amended. Now we need to vote on the amended motion. Any discussion? All those in favor signify by saying aye. Kristen, roll call vote, please.
Okay, Albertson,
Aye.
Aye.
Hoyer,
Aye.
Lean,
Aye.
Slalom,
Aye.
Manti,
Aye.
Rademski,
Aye.
Roby,
Aye.
Billhauer,
Aye.
Y.
Aye.
Motion carries.
Thank you. Okay, the next item on the agenda is old business. Is there any old business? Councilman Vilhauer.
I guess I'd like, we opened the door, and I think maybe Councilman Elberson, maybe you want to jump in, because you're kind of the one that's been driving this. But I guess I'd like to an update as far where we stand with the abatement, refund, whatever the case may be, on the urban renewal district tax assessment. Or Kristen, maybe you're in the best position to answer that, or Matt?
Either one. Kristen, you want to go first?
Do you want me to go? Okay. I contacted the county and I asked them about what the process would be. Currently under state law, the council wanting to essentially take that tax away is not an allowable reason. There's only certain ways that you can amend a tax once it's been certified to the county. A couple examples of that is if all of a sudden the building on the property was removed, was no longer there, or if it was an elderly freeze situation, or the property owner was tax exempt. But the council essentially just wanting to remove the tax is not allowed by state law. So that is what I found out from the county.
All right, thank you.
But as a follow-up to that, then I think you posited the possibility of, once we've collected that tax, we as a council could make a decision at that point to refund it if we so desired at some point. Is that a fair statement?
That's a fair statement. I would say that I wouldn't have all the tax payments until the end of the year.
Right.
There's 142 properties, so my staff would need quite a bit of time to put every one of those individuals into the
Sure.
accounts payable system. But yes, that would be the process.
I understand that completely, Kristen, but I guess I would suggest that we do entertain that idea when that time comes later in the year, depending upon where the whole COVID situation is at that time.
So not take action tonight?
Yeah, I mean, there's nothing that we can take as action tonight, but at some point down the road, consider putting that as an agenda item once we have in fact collected the tax, to refund it then.
Yeah, I would, this is Albertson, I would second that idea for sure, to look at that later, because there's some people that are, as we've been talking about tonight, that have some serious financial issues, and to add this tax on them at this point in time doesn't seem right to me. So I guess if we can't do anything about it, you can't suspend it, then I guess the next best thing would look at it in September or October, when the taxes are paid.
All right, thank you. Is there any other old business?
Actually,
Mayor, it's Don.
Councilman Roby?
Just a real quick question. If Heath is still on, just very brief, anything new on Cherry Creek, or still staying the course?
Yes, Councilman Roby, still staying the course. The pandemic has shifted plans a little bit for the developer. They're in a hold and wait period here, as well as, in regards to whether they would proceed with any work on their development. My recommendation would be is we kind of wait through some amount of time here, whether it be a month or maybe a little more, with the developer to still try to coordinate this grading with their project. That timeline, I don't think hurts our project. If we do end up having to do it on our own, it puts us into what I hope to be a drier season, either later this summer or the fall, if we perform the work on our own without the developer. So in a nutshell, that's where that's at.
Thank you.
You're welcome.
Thank you. Councilman Vilhauer?
Heath, as long as you're there, I've got an item of old business too that I've asked about in the past. It's been a few months now. Anything, I realize everything might be on hold financially, but anything change relative to the 21st Street bike path in our discussions with the FAA?
Yes, we have gained some ground on that discussion. We had some back and forth with the FAA. Our consultant, Helms and Associates, have been helping us with that project. That plat that we've presented is being represented to the FAA with easements instead of rights-of-way. To make a long story short, we're able to accomplish the same effect of cleaning up the airport property plat without having to go through the land release processes for airport property. Had we planted that as right-of-way like we originally proposed, we'd have to go through the formal land release process for airport property. So we've come up with an alternative plan to place easements on that plat to help clean up the airport property and the roads and things that encroach onto it. And that so far has been verbally approved by the FAA as an acceptable alternative. So where we're at is we've resubmitted that plat to the FAA for formal approval, and we hope to hear back soon. And since they've given us the verbal okay, I don't see why they won't approve it, but we'll wait for the formal approval, and then we can proceed with bringing that plat back through to council for approval, and of course then proceed with the pathway work along 21st.
Okay. I'm not going to pretend to understand what you just all told us, Heath, but the bottom line is we're making some progress with it.
Yes, I apologize. There's a lot of intricacies to this one, but the bottom line is if we get this plat approved here soon, we can proceed with the work with the path.
All right, thank you. Any other old
Mayor
business?
Albertson,
Councilman Albertson?
I've got two things. I'm not sure they're old business. I'm not sure if they're new business, but I do have questions on a couple of things. One, you did explain to me that the city cleanup is only postponed. I think in Watertown that's a pretty major item, and honestly, that it's always said that nobody is to go out and pick the bones. So to have people coming in from out of town, if they're not supposed to do that, I'm not sure where that would ever end. But you had said that's just postponed. It's not canceled for this year.
True.
I think cleanup is a big deal for a city to keep cleaned up. So that one, I guess as long as it's postponed, I'd be okay with that. Another one that I'm wondering about is by the municipal utilities, we've always had a kind of a city cleanup spot there for tree limbs and branches and all sorts of things that come in the spring of the year. And once again, now I saw it someplace that I don't know if that one is postponed or if that's just canceled for the spring. And my question would be, because I've been there many, many times, and the guys are there to hook the can up to the garbage truck, or else they come in with a loader and a truck, and I'm not sure how much hands-on. And we spent a lot of time tonight talking about opening the city a little, but I would certainly hope that we would try to help people in a cleanup business also.
Right, thank you. I'll let Heath answer that, unless, are you still there, Heath?
Yes. Yeah, excuse me. So to those points, Councilman Albertson, you are correct. The citywide cleanup, we had decided through conversations with the mayor, given formal approval, we decided to send out an announcement that we would postpone the citywide cleanup. Some of the concerns there, like you cited, were, whether that draw people into town to kind of treat it as a citywide rummage sale of sorts, which kind of happens. And then you have people going door to door looking for one man's trash potentially being their treasure. We wanted to avoid that. But the other component to that is we didn't want to expose not only our city staff, but also our contractors to all the hands-on labor that is involved in that project. I know that a good brunt of the material that gets put out is picked up by whether it be a payloader or a skid steer by mechanical means, but there is an awful lot of hands-on removal that has to occur, like the electronics, for example. They're all picked out and separated, and that would put our contractors and staff in I would call it, compromising situation to have to do that on a citywide basis for everybody's stuff that gets put out to the curb. So those are a couple of reasons why we thought that wouldn't be a good idea to continue that right now at this point. But we are hopeful we can maybe do a late summer event or something of that nature where it doesn't bump up so late in the year that we might as well just wait till next spring. That's our hope. So the other component, the 4th Avenue yard waste drop site, I talked with Mike Berger on this, and he too was on the line here. The concern, and I don't know, this site is a unique situation. It's a public location, open to the public, and we'd be promoting people to come there on an unregulated basis, more or less, as far as numbers and things like that, and promoting them to come to drop off their yard waste debris. So there's that issue, first of all, is, do we want to promote that? Maybe we do because it'd be minimal use, but maybe not because you could have 50 people there at once and no EDC guidelines being followed or instances like that. The other component is that Mike has brought up is that staff would have to man that. They conventionally have manned it, I should say, just to help prevent things from mattresses being dropped off there or inappropriate materials being wasted at that site. So that issue, I guess, is just a matter of whether we want for their test and a lot of times being in close proximity with the customers, helping them dump their green yard waste totes into the facilities that are provided there and things of that nature. So that one I'm kind of on limbo with. If the council deemed that we wanted to proceed with that, or any of these things for that matter, I mean, obviously we could proceed with them. But these are some of the talking points that Mike and I have come up with together and wanted to share with you. One last final note I'll make, the free landfill use for city residents. Mike and I were conversing with the mayor on this just today. And Mike has already sent out a public service announcement allowing for the public's free use of the landfill with a copy of their utility bill with them. One of the reasons being that we opened that one up is because we are seeing a huge spike at the landfill as of last Saturday for people just doing spring cleanup efforts. And so that's already occurring by the demand for them to want to come and get rid of their stuff. So we figured we'd go ahead and open it up to be free to city residents only with a copy of their utility bill. And we've got measures in place at the landfill where people will be in their cars, going through the lines, progressing out to the dump site that they need to unload their vehicle. And at those locations, people generally take turns. They're in and out of their cars, one or two at a time. And there's a little more distancing effect than what we might see in other situations. Mike, I don't know if you had anything you wanted to add to that, or if we could just hold for further discussion and answer any other questions you guys might have otherwise.
No, I think what we saw last Saturday with 180 cars was a threefold increase from Saturday, April 4th. And we're literally right now, we're at a continuous flow of customers Saturday where we had lines waiting to get in and out pretty much most of the day long, except for about half an hour at lunchtime and half an hour at the end of the day. That scale was busy nonstop all day long already. And so the people were paying. So we opted to open it up and take the charge off our residents at this time.
Okay, thank you. I'm in favor of continuing with the yard waste dump site because it's a big benefit to our community. But with a modification of just explaining to people that they have to do their own unloading. And in the past, we've helped. And so you're going to jump up on the back of the pickup and help them get their stuff off. And we just won't provide that service this year. And they can accomplish that with a public service announcement and a sign posted there. And normally someone's there. And so they would be there as usual just to prevent people from dumping garbage, because that's not a garbage dump. That's a yard waste site. If the council's, not opposed to that, I'll just direct them to do that. I think that's a service that the public relies on every year, and I did hear from numerous people that were shocked at the thought that it might not be available. So, all right, any other new or old business? Councilman Vilhauer?
I'm not sure who all got this. I guess I'm a chamber member, but I just like to point out, I got an email from Tim Sheen at the chamber this afternoon, that there are some grants available from the Save Small Business Fund for businesses that have between 3 and 20 employees, up to $5,000 in one-time supplemental cash grants that are available out there apparently. I'm not sure if it's first come, first serve, but if people want more information on this, the website that is cited is www.savesmallbusiness.com, or contact the chamber office for more information. Might be a little bit of help out there for some businesses.
That's really nice. Thank you. Any other business?
Mayor?
Yes. Who is that? Councilman Lallam, go ahead.
Actually, I was going to have Glenn, did you get a final number on what the chamber did for the gift cards?
I did not, just a number that as of 3 o'clock Friday, so I don't know where it ended up over the course of the weekend. Does anybody else know by chance?
I thought I saw 276,000.
Okay, it was 272 as of Friday afternoon, so it looks like a little more came in then. But outstanding. And what's
Their
interesting,
goal by Sunday was 300,000.
Oh, okay.
Oh, wow.
And remember, that is just what was raised during the radiothon. That doesn't count what people have been doing on their own the last several weeks as far as buying gift cards.
Wow, that's great. Thank you
Yeah.
for bringing that
So
up.
I wanted to point that out. The other thing I would say to Heath as well, with all the people that are at home and that, they're going through items, myself included, at their house, citywide cleanup would be a big deal this sometime this year. Just with people trying to get through and clean out stuff that they haven't had time to do in the past, that would be something that we should definitely look at moving forward, whether that be, in 2 months, a month, end of the summer type deal, but just as a way to get people to clean out and get rid of stuff out of their homes that they're probably going through as they have time now.
Good point. Thank you. Anything
I
else?
would just add on that we don't want to get too late in the year because we don't have the staff to accommodate all the electronic waste and all of the fall yard waste drop-off site, and as well as the e-waste, and we'll have two drivers on yard waste trucks when leaf season comes. So if it gets into fall, it becomes we don't have the staff, so it would be sooner than better then, I think.
Yeah, good point, Mike.
All right, thank you. Unfortunately, we don't have to worry about all the people coming to graduation and avoiding that weekend. Are there any liaison member reports?
Mayor?
Yes.
I would just like to commend, thank you for that. I would like to commend Todd Syree, all of the personnel at the airport. I want to tell all the business owners, families, everyone in town, I know everyone's just trying to figure out a way to make it through this, and here at the city, we're doing the same thing on all levels. I know that we could apply this to all of the city personnel. We're just trying to find a way. At the airport, while there's lots of businesses that are down, the latest numbers are airport travel are down 98%. That's nationwide, and it's dismal. And with air service being such a vital part of growing this community. Todd and everyone at the airport board and all the personnel, we're trying really hard to figure out a way to just keep this alive and keep it going. We are working with SkyWest, we are working with the FAA, and we're trying a lot of different things to just, we need to try to keep this going as best as we can, because the airline industry is not one that you can just start back up again. There are so many rules about flying into airports, gassing up, terminals, gate fees, bidding on your tracks and things like that, on when you fly and where you fly. There's a lot of restrictions, so it's not just you're going to wave a magic wand and it's going to come back. So as a result, the FAA is trying to keep it as normal as it could possibly be, knowing that we are in the most abnormal time as you could possibly be in. So I just want to tell the city of all of the people, we're trying very hard to keep airline a very viable product going forward in Watertown. And we just thank everyone for that. I would just wanted to commend everyone at the airport.
Thank you, Reed. Any other liaison reports? All right. Any announcements? Not seeing any. We do have a need to go into executive session this evening in order to discuss and consult with legal counsel on contractual matter and personnel matters. And we do not expect to take action upon coming out. So look for a motion. Motion by Holene, second by Vilhauer. Any discussion? All those in favor? Kristen, signify by saying aye. Roll call vote, please.
Okay. Albertson?
Aye.
Bueller?
Aye.
Hoyer?
Aye.
Helene?
Aye.
Lalong?
Aye.
Manti? Aye. Rademski?
Aye.
Roby?
Aye, and I assume we have to sign back in for the executive session?
Yes.
I believe so. Vilhauer?
Aye.
Why?
Aye.
Motion carries.
All right, thank you. So all those who are remote, log off and join the executive session.